Hello, my name is Sofia Medvedev and today I'll be performing a head-to-toe assessment. This is my room that I will be working with. Okay. Okay, so first I'm gonna go ahead and do some hand hygiene. I'm gonna wipe down my stethoscope. Okay, hello, my name is Sofia Medvedev. I'm a student nurse and I'll be performing a head-to-toe assessment on you. Let me just give us some privacy here. Can I see your wristband? Can I get your name and date of birth?
Oksana, August 14, 1975.
Thank you. Okay, wonderful. So first I'm just going to start by looking at you. You look, how old are you?
50.
50, okay. So your sexual development is appropriate for your age. Your skin color is appropriate for your ethnicity. Just looking at you, you do look symmetrical. You don't look like you have any physical deformities, and there's no foul odor coming from you. You don't look malnutritioned. Looking at your facial expression, your mood seems calm. You're dressed appropriately for the occasion. You're maintaining eye contact, and you're sitting upright, which is all great. Now I'm just going to have you stand up, and can you just walk a little bit forward and a little bit back, and take a seat. Perfect, so your gait is not of concern, you're not swaying or limping anywhere. Also your work of breathing is undistressed. Now I'm going to ask you, do you know what year it is?
2025.
Okay, do you know where we are?
We are in New Market.
Okay, and what's your name?
Oksana.
Okay, perfect. So now I'm going to go ahead and check your cranial nerve number 7, your facial nerve. So do you mind smiling, frowning? Do you mind puffing out your cheeks? And I'll try to blow it out. Perfect, so they went out equally. Now I'm going to have you close your eyes and lift your eyebrows. I'm going to try to open your eyes and don't let me. Okay, perfect. So your facial cranial nerve number 7 is intact. Now I'm going to look at your ocular motor nerve number 3. So first I'm just going to start by looking at your eyes. So your pupils are round. I'm not seeing any redness or discharge. I'm also looking at your gauge size, so you're about 3 millimeters on both eyes. They're symmetrical. Now I'm going to check for your direct and consensual light reflex. So if you don't mind, I'm just going to close one eye and I'm just going to look into your eye. Okay, so your eyes are reactive. This size is reactive to light, and this size is reactive to light. And now your consensual. Okay, wonderful, thank you. So your eyes are direct and consensual through light, and I know this because I use Perla. Now I'm just going to have you look at my tip of my pen, and I'm going to bring it closer and further. Okay, so your eyes are accommodating accordingly. Now I'm going to just look at your nose. So your nose is midline, and there's no cresting or flaring. Now I'm also going to I'm going to whisper a couple words in your ear. So if you don't mind closing this ear, and just repeat what I say, okay?
Honey, money, bunny.
Yes. And now close the other ear, please. And I'm going to say
Monday, Tuesday, Wednesday.
yes, perfect. Okay, so your acoustic cranial nerve number 8 is intact. Now I'm going to check for your glossopharyngeal cranial nerve number 9 and your vagus cranial nerve number 10. So I'm going to compress your tongue and just say ah for me when I do, okay? Ready? Say ah.
Ah.
Perfect. So your uvula and your soft palate both rose, meaning that your cranial nerves number 9 and 10 are both intact. So wonderful. Now I'm just going to check your upper peripheral system. I'm going to start by inspecting. So I'm just looking at your arms and I'm not seeing any discoloration. They seem symmetrical. The hair distribution seems even, and I don't see any scarring. And now I'm going to palpate, okay? So I'm just going to palpate for temperature. You are warm to touch, not cold. I'm going to check for turgor. There's no turgor on your arms. No signs of dehydration. I'm going to check for texture. So your texture seems normal, no abnormalities. And I'm going to check for tenderness. Are you in any pain when I touch you anywhere?
No.
No? Okay, perfect. So now I just need your fingertips, and I'm going to check for capillary refill. Okay, capillary refill is less than 2 seconds, which is great. Now I'm going to check your pulses. So just flip your arms over. I'm going to check your radial pulse. So they are equal bilaterally. The strength is 2 plus strong, and the rate is regular. The rate is 70 beats per minute, and the rhythm is regular. Now I'm going to check your brachial pulse. Just flatten out your ears. Perfect. So just checking your brachial pulse, the rate is 2 plus strong, the rate is 70 beats per minute, the rhythm is regular, and the rate is, the strength is 2 plus strong, the rhythm is regular, and the rate is 70 beats per minute. Perfect. So now we're just going to do some exercises. So if you don't mind, just follow along with me. So do supination, pronation. Do flexion, extension. Do extension, flexion. Do internal rotation, external rotation. Perfect. Do radial deviation and ulnar deviation. Okay, did you experience any pain during these assessments?
No.
That's good. All right, so now I'm going to check your lower peripheral extremities. So first I'm just looking by inspecting. So the color is even throughout, the hair distribution is even throughout. I'm not seeing any scarring or unwanted movements, and I'm not seeing any unsymmetry. It's all symmetrical and the color is good. That's great. So now I'm going to go ahead and palpate. So are you, okay, the temperature is regular, or it's warm to touch. Are you in any pain?
No.
Okay, no tenderness. I'm going to check for turgor. Okay, I'm not seeing any turgor, and texture is perfect. So texture, tenderness, turgor, and temperature, which we did. So now I'm just going to need your toes. I'm going to check your capillary refill. So just going to touch them. Okay, so capillary refill is less than 2 seconds, which is good. I'm just going to do some hand hygiene. Okay, now I'm going to check your posterior tibialis pulse. So just put your feet up if possible. You could just put them down here. Okay, so the strength is 2 plus strong, the rhythm is regular, and the rate is 70 beats per minute. Now I'm going to check your dorsal pedis or pedialis. Okay, so the rate is 70 beats per minute, the rhythm is regular, and the strength is 2 plus strong. So that's great. I'm just going to do some more hand hygiene. And now, if you don't mind, you can come back to the front for now. So I'm just going to do some range of motion exercises for you. So just bend your back, flex, and extend. Okay, I'm going to have you flex like this, and extend. And now with your other knee as well, flex and extend. Okay, now you're going to go with your toes, and you're going to go plantar flexion, dorsal flexion. And now your other one, plantar flexion, dorsal flexion. Okay, perfect. So did you have any pain during any of these assessments?
No.
No? Okay, that is great. So now I'm going to go ahead and move to your lungs and thorax assessment. So I'm just going to look at your area. So the shape seems, cone shape seems regular. There is symmetry. I'm not seeing any scarring, and I'm not seeing any, and the contour also looks normal as well. Contour doesn't look bad. Wonderful. So now I'm going to palpate. So I'm going to palpate for moisture. I'm not seeing any moisture. I'm not seeing, there's no deformities, skeletal deformities that I can feel. Are you having tenderness?
No.
No? Okay, the temperature seems normal. If you don't mind just turning around for me. Okay, and just stand right here. And can you take a deep breath in? And a deep breath out. Okay, that's perfect. So the lungs were expanding and falling symmetrically. You can now turn around. So now I'm going to do an interior assessment. So first I'm gonna show you where everything is. So this is your bronchial region, just here. Here, this is your vesicular region, right over here. And this is your bronchiovesicular region, just right here in the middle. So I'm just gonna give you some instructions. Every time I touch you with my stethoscope, do a deep breath in and a deep breath out. If you feel dizzy, we will stop the assessment and try it again later. And yeah, perfect. So for this, I'm going to use the diaphragm of my stethoscope. Okay, now take a full deep breath in and out. Okay, thank you so much. All right, so listening to your breaths, the breath sounds were clear. You were respirating around 17 breaths per minute. I didn't hear any gurgling. I didn't hear any adventitious sounds that I shouldn't have heard. So wonderful. So now I'm just going to check your anterior and posterior diameter. I'm just going to look right over here. I'm going to check right here. So your anterior posterior diameter is around 1 to 2, which is amazing. And I don't have any concerns with your lungs and thorax. So now I'm going to go ahead and do your cardiac assessment. So first I'm going to landmark. So just going to look here. All right, so this is your notch. All right, this right here is your angle of Louis and your second intercostal space. I'm going to go over, I'm going to find your right sternal boredom, your aortic valve. Now I'm going to find your pulmonic valve, left sternal border, second intercostal space. Now I'm going to find your Erb's point. Okay, and now I'm going to find your tricuspid valve right over here. Erb's point is third intercostal space, tricuspid is fourth intercostal space, and mitral is fifth intercostal space, left sternal border. Okay, and right where mitral is where I would also find my apical pulse. Now between my aortic and pulmonic valve, at the base of the heart is where I would hear S2 the loudest. And between the mitral and the tricuspid valve at the apex of the heart is where I would hear S1 the loudest. Now I'm going to go ahead and listen to your apical pulse for 1 minute. And I'm going to use my diaphragm for this assessment. So I'm just going to place it right over here, just in the middle with your middle line, your apical pulse. And I'm listening for 1 minute. Okay, so I did not hear any extra S3 or S4 heart sounds. I'm just also taking a look to see your work of breathing. It's not labored, or sorry, your heart doesn't seem like it's bradycardic or tachycardic. It's not beating too fast or too slow. And your heart rate is 70 beats per minute, and it's regular. And the pulse is 2+ strong. So now I would show you where I would listen and how I would listen if I wanted to hear the extra heart sounds using the bell side of my stethoscope. So I would just listen in the same valve area. So I would listen to the aortic valve at the second intercostal space, right sternal border, the pulmonic valve, second intercostal space, Erb's point, third intercostal space, tricuspid, fourth intercostal space, and mitral, fifth intercostal space. So you don't have any heart murmurs or any issues that I was able to see or determine, which is great. So now finally I am going to move on to your abdominal assessment. If you don't mind, I'm just going to have you lay down right over here. I'm gonna bring the audience a little bit closer. Okay, so for your abdominal assessment, I'm gonna make sure that you are draped properly. So I'm just gonna cover you with my blanket here. Okay, and I'm gonna lift your shirt. Is that okay? Okay, and I'm gonna bring down your pants here to take a look at your abdominal assessment. So first I'm gonna start by inspecting. So I'm making sure that my patient's umbilicus is midline. I'm not seeing any striae. I'm not seeing any, bulging, any irregular shapes. I'm seeing that the stomach is symmetrical. I'm also just gonna look at the contour from the bottom here. Okay, the contour seems fine. I'm not seeing any irregular pulses or movements that would cause me concern. And I'm also looking for hair distribution, which seems to be even on the stomach. And now, instead of palpating, I'm gonna go straight into auscultating using my diaphragm. So I'm gonna go ahead and check that it's working. And I'm gonna start lightly auscultating on the right lower quadrant, which will be right over here. And I'm listening for regular bowel sounds. Okay, now the right upper quadrant. Then left upper quadrant. And the left lower quadrant. Wonderful. So just looking at my patient, I was able to hear high-pitched bubbly sounds, which is considered a normal finding in the stomach. If I were to not hear anything, I would listen for 5 minutes in each quadrant. So now I'm going to lightly palpate. So I'm palpating for tenderness, for moisture, for any abnormal texture, guarding, or masses that I hopefully will not find. So just starting in the right lower quadrant, and I will be going clockwise. Do you have any pain or discomfort?
No.
No, thank you. Do you have any pain or discomfort?
No.
Okay. Do you have any pain or discomfort?
No.
No, that's great. And any pain or discomfort?
No.
Okay, I didn't feel for anything concerning. And to finalize this assessment, I'm now going to palpate lightly the bladder as I just lightly palpated the abdominal cavity. So it's just going to be in the middle here, and I'm just going to palpate. I'm not feeling any hardness. Does it, are you having any pain
No.
when I touch here?
No.
Okay, thank you very much for your time. This concludes my head to toe assessment. Have a great day.